Ready? Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan, Director of the Allegheny County Health Department, to give our weekly update on COVID-19 pandemic. You may have seen today, and Dr. Bogan will go into more detail, but we've seen some really good numbers today. We hit under 2%, a little over 1% of positivity rate, and even over the last number of days, we have seen the positivity rate somewhere in the 4, 5, 6% range. It has taken this region, this county, 2 months to get here. And a little bit of history, back in early June 5th to be exact, this county went into the green phase. And I think, again, a lot of us relaxed and certain things occurred, but we didn't see those results of tests, positive tests, for about 3 weeks or so. It wasn't until late June that we saw numbers go up over 100, over 200, and I think 1 or 2 days we had over 300. Today we had 14. But it has taken 2 months of great cooperation and vigilance on all of our citizens in this county working together to do that. But when you see that happen, you realize how quickly it can get out of control and how long it takes with a lot of hard work to get those numbers down. The other good news over that time is we did not see the severity of hospitalizations and fatalities that other regions have seen, other states have seen around the country. I think a lot of the spread, and Dr. Bogan talk about that, was among folks that weren't as vulnerable, weren't as high risk as some other populations that we're aware of, seniors, people who have pre-existing conditions of other diseases. So as we open up schools now, as we're going back with sports, with our colleges and university kids who have been coming back for the last week or so, while the numbers remain low now, where will they be 2 to 3 weeks from now? Because we have gotten some reports about not necessarily businesses having organizations or having activities, but private house parties, private porch parties, students often getting together. And I really want to commend our universities and the student leadership in these universities. Pitt, Duquesne, CMU, Robert Morris, Point Park, have really taken some action and have already issued warnings, talked about probation, shut down a few, a few sororities and fraternities to make sure that the seriousness of this and how quickly this can spread doesn't occur. So over these next couple of weeks, we want to certainly keep those numbers down before we can start talking about maybe even opening up some other things that maybe we could do, say in mid-September or some time frame along those lines. Obviously the masks, social distancing, physical distancing, being outside, all the things that we've learned and we've heard about from our health professionals over these months. And again, we know the activities are different. We know people have had to adjust how they work, how they worship, how they recreate, all the different things that we do. So again, we want to make sure, and I make this pitch again that I do almost every week, our restaurants have been affected by this. Please continue to patronize your favorite restaurants and restaurants in your community. Do it differently, do the takeout, do the outdoor seating, that type of thing. But we still want to make sure that the economic impact is as minimized as it can be. So with that, let me turn it over to Dr. Bogan to give her weekly report and then take some questions.
Good afternoon, and thank you for joining us. I've never put a lot of stock in one day's case numbers, but today's report really jumped out at me. My first question to our staff this morning was, is that a typo? It wasn't. My second question was this due to a low number of tests? It wasn't that either. Today's report of 14 cases was out of more than 1,000 tests for a single positivity rate of 1%. It's a single day, but recent trends suggest to me that our mitigation efforts to slow the spread of COVID-19 are working. According to the state's dashboard for the week of August 14 through 20, Allegheny County's positivity rate dropped to 3.9%, and our incidence rate dropped to 38 per 100,000 people. So we have been successful in decreasing the spread of COVID-19 in Allegheny County over the past 4 to 6 weeks. And with this decline, I have received many emails and calls asking to increase the outdoor gathering limits. I hear you loud and clear. My job as a public health director is to make the best decisions I can with the data I have. So in June, when we went from the yellow to green phase of the governor's reopening plan, gathering limits increased from 25 to 250. And within 3 weeks, we had a huge surge in cases. Thousands of college and university students from across the country and the world returned to Pittsburgh over the past 2 weeks. It will take at least 3 weeks to see the impact of these students on case counts. We are also an urban area. Data from across the country supports the assertion that this virus spreads more effectively in urban or crowded areas. Philadelphia, the largest metropolitan area of Pennsylvania, remains at an outdoor gathering limit of 50. Most importantly, I want to support all efforts to get children back to school as quickly and safely as possible. The lower our community spread, the sooner and the safer this can happen. With all this in mind, I am reconsidering our limits on outdoor gatherings and will announce any changes when they're made. I won't be increasing the capacity to 250, the state's limit at this time. I want to open things slowly and ease restrictions so we can watch how the virus responds. It is critical that outdoor gatherings follow all of the COVID-19 safety recommendations. People should keep at least 6 feet from others, avoid large crowds. The state's universal masking face covering order requires that everyone wear a mask outside if they cannot consistently keep 6 feet from others. Gatherings should allow for staggered arrivals and departures to avoid crowds at entrances or exits. They should take steps to avoid crowding at concession stands, restrooms, or elsewhere. And hand washing facilities or hand sanitizer should be available throughout the gatherings, and guests should be encouraged to use it frequently. Sporting events should follow the governor's guidance on guidance on sports, and K-12 sporting events should also follow the PIAA guidance. The 25-person limit on indoor gatherings will remain unchanged. The limit was set by the state, and the Allegheny County Health Department cannot modify a state order to make it less restrictive. The same will be true for the state-imposed restrictions on restaurants. Allegheny County's public health order closing restaurants to dine-in service at 11 p.m. and prohibiting smoking remains in effect. Any changes to limit the outdoor gatherings is not a signal that the threat from COVID-19 is any less. People can still catch the virus and spread it without knowing they have it. People, especially the elderly and vulnerable, still become very sick and can die. The virus can spread among people, groups of people who gather without wearing masks or keeping safe distances from one another. And the virus can still spread to our families and friends and can still work its way into our nursing homes and care facilities. Over the past several days, the health department has received many comments from parents of young athletes and the athletes themselves asking us to modify public health measures in effect so athletes can play and parents can watch. I agree with you. Sports, physical activity, and exercise are important for all of us, and especially for children. However, team sports are situations where the coronavirus can spread if safety precautions like masks and distancing aren't followed. Many of you also commented that children are not likely to have severe illness, and I agree. They're also likely to be asymptomatic and unaware that they are shedding the virus. The virus then quickly spreads to more vulnerable populations, and that is my concern. So vigilance and hard work is still needed from everyone. Please stay home if you are sick, get tested if you have any symptoms of COVID-19, limit your trips out of the house to essentials like food, medicine, and exercise, wear a mask if you go out, take steps to avoid close contact with others in large groups, wash your hands or use hand sanitizer. Thank you, and stay safe, and please be kind.
The first question that we have today is from the Post-Gazette. We also have a similar question from WTAE. On Monday, the CDC changed the guidelines for testing again. It now says that people who have been in close contact with someone who has tested positive doesn't necessarily need to be tested. What is the county's opinion on this change? Does the department intend to follow this new guideline or encourage anyone who wants to get tested to be tested? And does this conflict with the push to increase testing?
So as I understand it, the CDC guidance still says that you should get tested if a local health official recommends that you get one, and I do. We are still recommending close contacts of those who are close contacts of a case get tested, and that is what our contact tracers will continue to tell people when we call them.
This next question is from WTAE. How early should people get the flu shot, and is there any concern with overcrowding at flu vaccine clinics during the pandemic?
In terms of recommendations for the flu vaccine, flu vaccine, you start making antibodies within 2 weeks, around 2 weeks after getting the vaccine, and then you do start waning some activity, so we want people to get it sometime between sort of the end of August and by the end of October, and that's based on the guidance from the ACIP. In terms of crowding at flu clinics, I hope the flu clinics will all follow the guidance we have of physical distancing, people wearing masks, and again, if that is done, then we should be okay.
Could you address why the number of tests have fallen recently?
So I think the numbers of tests for the past couple of weeks have been about the same, about 1,000 plus or minus tests per day. And again, I think that really reflects that our demand has gone down substantially. We have way fewer contacts of cases because we have fewer cases. So the health department isn't sending as many people to go get tested. And when cases decline, demand for testing declines.
This next question is from WPXI. Lawmakers in Beaver, Butler, and Lawrence County are asking for answers after COVID mandates shut down their outdoor events and flea markets, while they say a big Corvette show, dubbed the biggest in the world, will go on starting Thursday in Carlisle. Can Allegheny County officials respond to allowing that car show to go on? And if the event was held in Pittsburgh, would they allow it?
So I'll just say in Allegheny County, we put a 50-person limit on our outdoor events and gatherings. And I think that and other public health measures have worked really to really tamp down our spread here in our county. So.
This next question is from WTAE. Do you have any update on the effect protests have had on recent numbers? Some viewers still believe it to be a double standard, that we're allowing large protests, yet businesses are fighting to stay afloat. Is the county asking about protests or rallies in its case investigations?
So we have been asking about large events and gatherings for weeks now. We've reported those out repeatedly to folks, and protests are part of that question. And over the past 9 weeks, we've had 15 people respond that they've been to a protest, and I don't think we've had any people respond in the last few weeks.
Many movie theaters reopened in Allegheny County last week, and more will reopen this Friday. What measures does the health department think a movie theater should be taking to keep guests safe? And more broadly, is going to a movie considered a safe thing for someone to do?
So the governor's guidance gives clear recommendations to businesses on how to open safely. And remember, the guidances are really developed for businesses to keep their patrons safe. So if people follow those guidances, they should be okay. And again, don't forget, guidances are also based on the most up-to-date data we have. And so based on what we know about the virus right now, that's the best guidance we can offer. So again, I just encourage those businesses that are running movie theaters to just follow the state guidance carefully.
And this is the last question, again from WTAE. A major soccer tournament is being held in Plum this weekend with several thousand people from around the state coming here. What concerns, if any, do you have about this? Has the health department had any discussions with the tournament organizers? Your July 17th order prohibits outdoor gatherings, so how will this soccer tournament be able to stay in compliance of that?
So I don't know many details about the sporting event that you're talking about. I'll remind people this was raised in the past about other sporting events. When you have a large sporting event where you play teams serially. So you play Team A plays Team B, and then Team B plays Team C, and then Team A plays Team D. What you're doing is you are basically allowing people to come together. You may just only play in a small group here, but you're going to be able to spread the virus. If you have somebody who's not symptomatic, and again, in this age group, many people are asymptomatic, they can effectively spread the virus to a large group of people. So I just ask the organizers to be very careful and cautious, to follow the state guidance and on sporting events and our local gathering requirements strictly. And the one other comment I'll say, I have a daughter who played soccer, and I've been to many a soccer game, and I know that parents and those in the field on the sidelines get very excited about the play, and they tend to shout and yell, and that is a very effective way to spread virus. So please keep your masks on when you're shouting at a game, because that is an extremely effective way to spread a virus. So again, I hope you're all following the guidances carefully, the state guidance, and we will look into the sporting event. Thanks.
That was the last question. If there's any closing
Very,
remarks.
very nice. There you go.
Yeah, and also let me follow up on what Dr. Bogan talked about, your question regarding the tournament. We have gotten some calls about that tournament, and we will be checking in on that and enforcing it. As you probably know, there have been a number of activities and other clubs and restaurants that have been shut down for violating the rules. The PIAA has put out some guidelines that we think make some sense, WPIAL following them. Unfortunately, private organizations, sporting events don't necessarily follow those, but they should. They should be following the recommendations on wearing masks on the sidelines, limiting the amount of folks who are standing there. In fact, they have no crowds, no fans that can come to these events. So there's ways in which it can be done. And what we have learned over the last number of months, not just these last 2 months, that activities that follow the guidelines can be done safely. We have opened up the vast majority of our economy here in Allegheny County safely, because people are wearing their masks, they're following the rules, they're doing the things that need to be done. What we have seen is when things aren't being followed, the rules aren't being followed, things can get out of control very quickly. You may have seen the story in Boston, in which earlier this year there was a conference, and out of that one conference, literally thousands of cases have spread. It can spread that quickly. So we don't want to allow one activity or one tournament that could have thousands of people coming in, allow all the other things that we've done to be impacted. So we'll be following up, and if it's a multi-county operation, which I understand this one might be, we'll certainly be working with our friends at the state to make sure these things occur. We know sports is very important. My kids played. It's a wonderful, wonderful thing. But we've already seen in some instances where teams have had to stop practicing, football teams, cheerleading, because of an outbreak within the group. Some of it's happened, whether it be on the field, some of it's happened with socializing outside of that, as our contact tracers have been able to determine. So if we continue to be vigilant, if we continue to follow the rules, we'll keep those numbers down. Schools can open up, more activities can open up, but it can only happen if everybody is cooperating. So please keep up the great work that people have done. It's been quite a journey to get these numbers down over the last couple of months. Dr. Bogan and her team, the strategy that they put in place obviously worked. We want to continue along those lines, and